Did you know that chronic kidney disease is the seventh leading cause of death, affecting more than 850 million people per year worldwide? And the worst thing is that 90% of individuals with kidney disease don't even realize they have it. Kidney disease often goes unnoticed until it reaches an advanced stage. And that is usually where the disease has already slipped out of our control. Have you ever wondered if you might be at risk? Do you know what symptoms to watch out for? It's really easy to ignore daily fatigue, changes in urination, and even itchy skin. We neglect these issues, calling them a part of life that will pass on its own. What if it is actually your body's way of alarming you that something is seriously wrong? In this video, we will find out the 10 warning signs of kidney disease that you should never ignore. Watch till the end because number 2 will shock you. But before we begin with the warning signs, let's take a moment to understand why your kidneys are so important. Your kidneys are a pair of bean-shaped organs located just below your rib cage. Their role is to filter waste, toxins, and excess fluids from your blood in the form of urine. So in a way, they purify your body. Apart from that, they also regulate your blood pressure, produce some important hormones, and maintain electrolyte balance in your body. Now, you can imagine what would happen if the kidneys stopped functioning normally. Improper kidney function can have a severe impact on your overall health. Unfortunately, many people don't recognize the early signs of kidney disease, which can lead to delayed diagnosis. This results in more severe complications. Recognizing these symptoms early on can help you take action and prevent significant kidney damage. Disclaimer: the information provided in this video for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have seen or heard in this video. So without further ado, let's find out the 10 warning signs of kidney disease that you should not ignore. Number 10, you always feel tired. Have you been feeling unusually tired all the time? You don't feel well rested even after a good night's sleep? Beware, fatigue and lack of energy are the initial signs of kidney disease. As you know, your kidneys play an important role in filtering out waste from your body. When the kidneys are not working as should be, the toxins stay and build up in your bloodstream. This makes you feel exhausted and weak. Furthermore, kidney disease can also result in anemia, a condition in which your body is not able to produce enough red blood cells. Red blood cells, or RBCs, carry oxygen to your muscles and body organs. When these RBCs are short in supply, the oxygen regulation within your body is not sufficient and you feel tired all the time. So if you are constantly feeling drained for no apparent reason, it could be a sign that you have an underlying kidney disease that should be addressed as soon as possible. Number 9. Changes in urination. Do you find yourself waking up multiple times at night to go to the bathroom? This condition, known as nocturia, can be a sign that your kidneys are struggling to filter waste properly. One of the most obvious signs that something is wrong with your kidneys is a change in urination patterns. Since your kidneys are responsible for producing urine, any significant change in frequency, color, or consistency should raise a red flag. If you're urinating less often, it could indicate that your kidneys aren't producing enough urine. Sometimes, your urine might look frothy or bubbly. It could be a sign of proteinuria. Proteinuria is a condition where excess protein is leaking into your urine. This is often one of the earliest indicators of kidney disease. Next, you could also see blood in your urine if you are suffering from kidney disease. This means that your kidney's filtering system is damaged and is allowing your RBCs to leak into your urine. So if you notice any of these changes, immediately consult a healthcare professional before things slip out of your hands. Number 8. Your legs, ankles, and feet start to swell. Another warning sign of kidney disease is swelling or edema in the legs, ankles, and feet. When your kidneys aren't functioning correctly, they can't remove excess sodium and fluids from your body. This leads to fluid retention, which causes swelling in your lower extremities. This swelling can be uncomfortable, making it difficult to walk or wear shoes, and it can also be a sign of more serious underlying issues. Sometimes, it's not just the lower extremities. Many individuals with kidney issues may also experience puffiness around their eyes. If you notice that your legs, ankles, or feet are persistently swollen, it's important to consult a healthcare professional to determine the cause. Before we move on, here's a quick fact. Did you know that over 10% of the world's population is affected by kidney disease? The next sign we're about to discuss could be a game changer in recognizing kidney issues early. Don't miss it. Number 7. Your skin becomes itchy and dry. Your kidneys are an all-rounder. They not just filter out waste from your body, but also work hard to regulate the balance of nutrients and minerals in your body. During a kidney disease, this balance is disturbed due to the accumulation of waste and toxins in the bloodstream. This condition is medically known as uremia, and its symptoms include persistent itchy and dry skin. This itching is not normal. It is usually severe and is not relieved by moisturizing and other typical remedies. Furthermore, the imbalance of calcium and phosphorus levels caused by kidney disease can cause many skin-related issues. So if you find yourself constantly scratching yourself, or if your skin has become unusually dry, don't neglect this. It could be a sign of kidney disease. Number 6. You feel difficulty breathing. Have you been experiencing shortness of breath? Well, it can be frightening. And guess what? It's another symptom that could be linked to kidney disease. So what is the link between breathlessness and kidney disease? First, when your kidneys aren't filtering fluids properly, it can cause fluid to build up in your lungs, leading to shortness of breath. This condition, known as pulmonary edema, can be life-threatening if left untreated. Second, it is anemia again. When your body lacks enough red blood cells to carry oxygen throughout your body, it can result in shortness of breath, even after minimal physical exertion. So if you are struggling to catch your breath without a clear reason, seek medical attention at once because the culprit might be kidney disease. Number 5. You don't feel hungry. Have you ever experienced a sudden loss of appetite? It is possible that you might not be feeling as hungry as you used to, but it may seem like a phase to you. It might be a phase, and it might be not. Loss of appetite could also be a warning sign of kidney disease. When your kidney function is impaired, waste and toxins accumulate in your bloodstream and interfere greatly with your digestive health. The interruption in digestion often results in loss of appetite and nausea. Sometimes, kidney disease can also cause uremic gastritis, a condition where the lining of your stomach becomes inflamed due to the presence of uremic toxins. This can result in stomach pain, nausea, and vomiting. So if you're losing interest in food or experiencing frequent nausea, remember, it might be a sign that your kidneys need help. Number 4. You experience frequent muscle cramps. Muscle cramps, especially in the legs, can be more than just a nuisance. They could be a sign of kidney disease. As we discussed earlier, your kidneys help maintain the balance of electrolytes in your body, including calcium, potassium, and sodium. When your kidneys aren't functioning properly, these electrolytes can become imbalanced, leading to muscle cramps, spasms, and twitching. In many cases, muscle twitches, weakness, cramps, and pain may also be a result of fluid retention caused by kidney disease. In this case, excess fluid puts pressure on your muscles and nerves. Some people may even feel pins and needles sensation in their arms and legs. Not only that, some people with kidney disease might even lose sensation in some areas of the body. Number 3. Your blood pressure rises. High blood pressure or hypertension is both a cause and a symptom of kidney disease. Your kidneys regulate your blood pressure by controlling the amount of fluid in your body and the levels of certain hormones that help maintain blood pressure. When your kidneys aren't functioning properly, they may struggle to regulate blood pressure, leading to hypertension. When blood pressure increases due to kidney disease, it is medically termed renal hypertension or renovascular hypertension, and this shouldn't be ignored at all. Over time, If left undiagnosed and untreated, high blood pressure can further damage your kidneys, creating a vicious cycle that accelerates the progression of kidney disease. So if you have high blood pressure, don't just let it be. The underlying cause can be more serious than you can imagine. Number 2, difficulty sleeping. It's all too easy to overlook the significance of sleep in our busy lives. Many of us experience occasional sleepless nights and simply brush them off, thinking they're just a part of life. But what if those restless nights are more than just an inconvenience? It's not uncommon to suffer from sleep issues and ignore them without realizing that they could be signs of something more serious, something potentially life-threatening. If you're having trouble sleeping or dealing with insomnia, your kidneys could be to blame. Various sleep disorders, including insomnia, sleep apnea, and restless leg syndrome, may take place when your kidneys aren't functioning properly. Waste and toxins can build up in your bloodstream, leading to feelings of restlessness and discomfort that make it difficult to fall asleep or stay asleep. According to research published in the journal Kidney Medicine, about 50% to 75% of people with kidney failure have trouble sleeping, and 80% of those on dialysis also have sleep problems, including feeling very sleepy during the day. Many kidney disease-related problems can interfere with your sleeping patterns, such as restless leg syndrome, which is often associated with kidney disorders, may disrupt your sleep due to uncomfortable sensations. Similarly, itchy skin can also cause sleep disturbances. Sometimes, kidney disease can lead to sleep apnea, a condition where your breathing is interrupted during sleep. Sleep apnea can lead to poor sleep quality, fatigue, and an increased risk of heart disease and stroke. So never take sleeplessness easy. If you're experiencing persistent sleep problems, consult a healthcare professional right away. Number 1, foods start to taste metallic. Have you ever noticed a strange metallic taste in your mouth? If so, it might be more than just a passing oddity. It could be a warning sign of kidney disease. This condition is known as dysgeusia. It happens when waste products start to build up in your bloodstream. But why does everything suddenly taste metallic or bitter? As your kidneys struggle to filter out toxins, substances that should have been flushed out start moving around in your body. This can make food taste weird, often leaving you with little appetite and making meals less enjoyable. You might then reach for salty or sugary snacks to cover up that odd taste, but that only makes things worse, especially if you have diabetes. The metallic taste isn't just an annoying quirk, it's a signal that something more serious might be happening inside your body. As your kidneys lose function, the balance of minerals and nutrients gets thrown off, which can mess with your sense of taste even more. This, along with all other signs and symptoms we have discussed, can take a toll on your quality of life. Now, what exactly should you do when you notice these symptoms? If any of these warning signs sound familiar, it's time to take action. Kidney disease is a serious condition that requires prompt attention to prevent further damage. The first step is to see your primary care physician or a kidney specialist. Make sure to discuss all your symptoms in detail, even if they seem unrelated. Next, get blood and urine tests to check how well your kidneys are functioning. These tests detect the presence of protein, blood, or other abnormalities in your urine that could indicate kidney disease. And yes, since high blood pressure is both a cause and a symptom of kidney disease, it's crucial to keep an eye on your blood pressure regularly. If you're diagnosed with kidney disease, your doctor will likely suggest lifestyle changes to help manage your condition and slow its progression. Remember, kidney disease is a serious and often silent condition that can have a profound impact on your health if left unchecked. Recognizing these warning signs early and seeking prompt medical attention can make a significant difference in managing the disease. So don't ignore these signs. Your kidneys are essential to your overall health, and taking care of them should be a priority. Have you experienced any of these symptoms? Have you ever had your kidney function tested? Pour in your experience and thoughts. We'd love to hear from you. If you like this content and want more informational videos like this, make sure to hit the like and subscribe buttons. Till then, stay informed and stay healthy.